Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. In 2023, West Virginia had the second highest rate in the nation for new lung cancer cases and the worst rate in the nation for adults who currently smoke. I know, that's really depressing. But surgery is a common treatment to remove lung cancer, but some cancer may be difficult to find during surgery. Enter CYTALUX, an imaging agent that literally lights up the cancer during surgery in real time, making it easier to see and remove. So today, we're talking about CYTALUX lighting the way for detection of lung cancer during surgery with Dr. Nicholas Baker, thoracic surgeon at the WVU Heart and Vascular Institute. Welcome, Dr. Baker, to Live Healthy West Virginia.
Thanks, Mary. Thanks for having me.
It's great having you here. So,
it's good to be home.
Good. Yeah, it's good to have you home. We love it when we have our native sons here. I mentioned in the introduction that lung cancer can sometimes be difficult to find during surgery. Mm-hmm. Why is that?
Well, that's a good question. The majority of lung cancer surgery nowadays is done with small incisions, or VATS, V-A-T-S. That's video-assisted thoracoscopic surgery. And over the past 5 years, robotic surgery has really kind of came into the forefront for lung cancer. So if you could imagine small incisions with small robotic arms in the body, we can't feel like we can with our hands. So sometimes finding the cancers can be difficult, but the small incisions drastically help our patients. So it's what we do.
Quicker recovery.
Absolutely.
Yeah. Okay, so then what is CYTALUX and how does it help in detecting lung cancer during surgery?
Yeah, so CYTALUX is a IV medication that we give preoperatively. It's basically vitamin B9. It's a folate agonist that has a immunofluorescent tag on it, and with a special camera, when intraoperatively, that medication preferentially goes to cancers, which absorb all of those vitamin B9. So then the camera allows us to see the light up of that fluorescent signal, and we're able to take out smaller pieces of lung, which are we would call what's called a sublobar resection. So we're not only doing surgery with small incisions using the robot, but we're able to see those lesions and take out less lung, so patients have less debilitation.
With the help of CYTALUX.
Correct.
Wow, so it just lights it up like Christmas lights.
Yeah, it depends on the setting. Majority of the time it's green. We've got a nice little fluorescent rainbow type setting as well. Be happy to show you some pictures.
Are there any other benefits to CYTALUX?
Yeah, I mean, so localization is what got me interested with CYTALUX, but through my work with CYTALUX, there are a couple other aspects that we identified that are very helpful. The first is margin assessment. So margin basically means we don't want to just cut the cancer out. We want to cut a normal rim of lung tissue out as well. And that normal rim of tissue is called the margin.
Okay.
So if I can see the cancer, I can ensure that I have a nice rim of normal tissue around it. So it's really helpful with margin assessment. And potentially, we may not even need to use a pathologist to assess that margin if we can do it with our own eyes intraoperatively. The other aspect, which I didn't expect to identify, but doing our initial study with this, we were able to identify occult lesions in specific patients. So,
what is an occult lesion?
So occult lesion would be a lesion that we didn't identify on the CAT scans or the PET scans preoperatively. In particular, if it's a patient that has a colon cancer or a pancreatic cancer or breast cancer, those cancers can go to the lung very frequently, and we use surgery to clear those. And what we find with CYTALUX is we're able to identify really small lesions in the lung that we didn't know were there and potentially could have been missed if we didn't use CYTALUX.
Oh, okay. All right. Wow. This stuff does good things.
I mean, it's an exciting new world.
Well, and it does sound like a newer cutting edge technology, but I understand that you were the first thoracic surgeon involved in the commercial launch of CYTALUX.
Yeah, I was blessed. I had a previous partner that did some of the work to get FDA approval, and then I became the person that was chosen to launch the drug. So I helped the company and the camera company to fine tune everything, and then once we did a subset of patients, then the first post FDA case was done. And then we never looked back.
That must have been really exciting,
It was very exciting to be part of something like that, especially because this is the first drug of its kind.
Yeah.
This is a class of drugs that we have labeled as intraoperative molecular imaging. So this is the first one. So to be the first person to use it after FDA approval in a new class of drug to help identify cancer was, like a kid in the candy store. I mean, I couldn't have been happier.
Wow. So you're a kid in the candy store now, but what did you do? How did you, before CYTALUX, how would you find and identify the lesions?
That's another really good question. You're really getting to the heart of this.
Mm-hmm.
So beforehand, we had to use our eyes and use the instruments to kind of push on the lung, feel the lung, look at the CAT scan, look intraoperatively, and try to identify it. There are some techniques that we can do if we know what segment of the lung the lesion is in. We can take out that in particular segment. But sometimes we can't identify what segment it's in or where the lesion is, and then we would have to take out larger amounts of lung to ensure that we got out the lesion. So with CYTALUX, the goal is to shrink the amount of lung that we take out and give the patient an adequate cancer operation.
That's wonderful. What is CYTALUX? You mentioned CYTALUX is basically, it's a folate, right?
Yep. Mm-hmm.
It's a vitamin.
It's a vitamin.
So it's good for you too, right?
Well, I mean, it does have some side effects, which are minimal. We give medications in the pre-op area to help with that. The most common thing is a little bit of nausea, a little bit of flushing, but standard medications we use in the hospital help prevent that. In our the FDA post FDA market release, we didn't have anybody that couldn't tolerate the medication.
Great. So how and when is CYTALUX administered? So
it's administered preoperatively. So when the patient comes for surgery that morning, they get an IV started by the nurse, and then the medication gets started along with some pre-medications to help with nausea and flushing. So that drug has to run for 1 hour, which usually, if you've had major surgery, you're usually there for at least an hour before your surgery starts. So it really doesn't slow anything down. Okay. And then after the drug is infused, the patient goes to sleep with anesthesia. After the finish of the drug infusion to surgery needs to at least be another hour. And usually with positioning of patients and things, that's not an issue either. And then the medication's ready to use, and we can get started.
Wow, that's really cool. On which patients do you choose to use CYTALUX? Is this for everybody?
So, I mean, you always try to be a good steward of healthcare costs and things, and there are a subset of patients that we don't necessarily need it for. If you have a larger mass that I know I'm going to be able to find, or if I'm going to do a standard lobectomy, which is to take out a lobe of the lung. You have 3 lobes on the right and 2 on the left. So if I know that I have to take out the lobe of your lung, I don't really necessarily need it. But during my training, we had some retrospective data that suggests a segmentectomy, which is a partial lobectomy, is as good as lobectomy for smaller tumors. And that has been kind of indoctrinated in our society And there was a new randomized control trial that proved that it is as equal to lobectomy. So if we can do a segmentectomy, which is a sublobar resection, then we try to do that for patients. And that's where CYTALUX comes in. Doing a sublobar resection it's very helpful during those cases.
I guess it's best to, when you can, take out the smallest part of a lung as possible.
Yeah, I mean, so it's a plus and negative, right? We want to make sure we take out as much as we need to have a good cancer outcome,
Right.
but we don't want to take out a lot of normal tissue.
Right.
So we have to rely on the data and our history and studies and things to know when that's appropriate. So, but just in summary, sublobar resections, CYTALUX works very well with. Metastectomy cases, that's what I mentioned about travel of cancer from some other organ to the lung.
Yes.
Yeah, and there's a specific type of non-small cell lung cancer, which is called a ground glass opacity, that works well with CYTALUX.
With CYTALUX, okay. Yeah, so it's not just for lung cancer.
Not just for lung cancer.
Okay.
And a matter of fact, the first indication for CYTALUX was ovarian cancer.
I did read about that,
Mm-hmm.
yeah. Doing a lot of exciting things here. Are there any side effects from CYTALUX?
None long-term that we're aware of. Just in the infusion, we call them infusion reactions, and that's the nausea, the flushing, and sometimes patients will feel a little short of breath. But with the pre-medications, most patients can tolerate it well.
Okay. Now, I feel like with all this talk about, detecting lung cancer, we have to talk about screening.
Thank you.
Yeah, lung cancer screening as well. I know, here comes another depressing statistic. According to the American Lung Association, 240,000 West Virginians are eligible for lung cancer screening, but only 5% of those eligible are currently screened. Can you talk, why do you think that is? And can you talk a little bit about, we have several lung screening programs in the state of West Virginia.
Absolutely,
We're really trying to fix this, aren't we?
So I will tell you, recently coming back home to West Virginia.
And you're from?
I'm from McDowell County, West Virginia, a little town called Yeager, if anyone's ever been there. But coming back to West Virginia as a lung cancer surgeon, this is definitely my focus. I know that I have nice bells and whistles with the robot and the CYTALUX, but at the heart of all this, the only way to really impact lung cancer is lung cancer screening. And there's a lot of good work that has been done here at WVU in order to promote lung cancer screening. As you well know, the Lucas truck is a mobile lung cancer screening truck, which was one of the first in the nation, and is touted across the whole nation as an ideal way to reach rural America. I'm very excited about being a part of the Lucas truck lung cancer screening. I'm a faculty of the Heart and Vascular Institute, but I work very closely with the Cancer Center, and there's the WVUcancer.org is a great way for patients to really be their own advocate and kind of dig into the website and figure out what's best for them, because it's a lot of it is education. People need to understand that it's there. Most insurances cover it, and at the end of the day, there's funds that can be dealt out for people that can't afford lung cancer screening.
And that Lucas truck, I think we need to make that clear. That is a traveling.
Absolutely.
CT scan?
Yep, it's a truck with a CAT scanner, and it goes around the state. It sets up the schedules on the WVUcancercenter.org. You can ask your primary care physician. They've got all the schedules for when the truck's going to be around, and then WVU Medicine's outreach, through the hub and spoke type of outreach throughout the state. We're setting up lung cancer screening in all of those areas. I hope that I can be a part of that and drive that through the state, because that is the way that you beat lung cancer.
I mean, I have relatives in my family that just through their PCP every year get the lung cancer screening. I mean, and they quit smoking a long time ago, but it's still important to get screened.
Absolutely, absolutely. There's a lot of negative stigma with smoking, and patients feel that. As a medical provider, I would rather patients not smoke, but I don't judge them for smoking. I just encourage them, if they have smoked in the past, or if they currently smoke, or if they have a loved one that previously smoked or currently smoke, like, they should ask their healthcare provider, because there are some little caveats of who can be screened. But if I could get anything across from this today, is that if you have a history of smoking or currently smoking, just ask about lung cancer screening. That will go a long way. And
your insurance will cover it.
Absolutely.
Yeah. Yeah. We're trying to make it as easy as possible. So let's talk a little bit now about the depth of experience of the thoracic surgery team at the WVU Heart and Vascular Institute. You guys are always doing something exciting over there, but let's talk about your team in regards to using CYTALUX for lung cancer and other cutting edge procedures.
Yeah, I've been away for about a decade, and I felt like this was an opportune time to come back, just because of the leadership at the HVI with Dr. Badwire, and he has a innovative mind. He's created procedures of his own. He brings in national leaders, international leaders, just to watch him operate, and being able to be the first to use CYTALUX and incorporate that back into the state just kind of goes along with his mindset of innovation. Our department in thoracic surgery, we can do the full breadth of thoracic surgery, from airway surgery to lung surgery to esophageal surgery for esophageal cancers, even benign esophageal surgery for reflux. So we have the full gamut here in the state. I'm glad to be a part of that, and I want to help as much as I can. But they were already well established, and they're leading the nation in thoracic care, and hopefully I can be a big part of that.
Yeah, and I think a lot of people don't realize that this is right in our front yard. It's not in our backyard. I mean, you don't have to leave the state to get world-class care. I mean, we're doing it right here.
Absolutely, and we're doing it at more sites as the years progress. As a medical student, most things at WVU was focused at Ruby. Whenever I went off for training, and now that I'm back, it's a completely different world. Yeah. I have thoracic surgeon partners in several different facilities across the state doing the same thing that I do in those areas. I spend time here at Ruby, and I spend a lot of my time at UHC, which is in Bridgeport, Clarksburg area. So we're really kind of trying to expand out and help the people of West Virginia.
Okay. So before we go here, I always like to ask you, what's the most important thing you want our viewers or listeners to know about CYTALUX for lung cancer and lung cancer screening?
So I would say CYTALUX is a very useful tool for me and my partners. It's here. We were the first to use it in the state. I was the first to use it in the world. We're going to continue to use it. But what I really, and as long as you go through thoracic surgery at WVU Medicine, you're going to have access to that. But what I really want to focus this on is lung cancer screening. Like, if there was one thing that, if we could get across the state, is that lung cancer screening is the only way to beat lung cancer. I can take out lung cancers all day with surgery, but I'll never impact mortality until we can increase these numbers, which you mentioned. The Lucas truck is one of the best ways, but the really public education and acceptance from the public to just get your scans. If you can get your scan and we can identify this as a lung nodule, and I can do a sublobar resection, with CYTALUX, you pretty much have a cure.
Yeah.
If we catch it late, then we're talking about, prolonging life. So if there's one message, it's get your lung cancer screening CAT scan.
Get it as early as possible.
And get your family to get it. Get your friends to get it.
Definitely.
We don't scan your animals yet, but who knows?
Yeah. That's great. Well, we'll be looking forward to that. Thank you so much. This was great information, and I hope we've helped a lot of people today.
Hope so as well. Thanks for having me, Ray.
Get that screening. Get that screening. Thank you. That brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about lung cancer surgery at the WVU Heart and Vascular Institute, visit wvumedicine.org/thoracic. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or on the all-new West Virginia Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Baker and everyone at WVU Medicine, thanks for joining us.